Hey, what's going on, everyone? Dr. Beau here. Today, I want to help answer the question about neck pain. Primarily, when you're having neck pain, who is the right doctor for you to go see? You know, there's not a week goes by, probably not even a day goes by, honestly, where people will come into our practice and they'll say, "Hey, Beau, I've been having this neck pain for X amount of time and I didn't know who to turn to. Do I turn towards my medical doctor, a chiropractor, a massage therapist, an orthopedic surgeon? Like, who is the right person's office for me to be in?" So I thought today that I would just make a quick video and discuss that. Now, when you think about medicine, primarily, which doctor to go to, the way I choose to look at it is like this. This is the lens that I use. Number one, is this an emergency care situation? Meaning, do I have blood and guts going everywhere? Or can I just not feel my arm completely? Like I just fell down or I got in a car accident and my side of my face and my arm is completely paralyzed. If either of those two situations are at hand, then my opinion, you should go to the emergency room and be checked by an emergency room physician. Why? Because their goal, their job is to save your life at that exact moment. Many times a patient will go to emergency room and then they'll be referred to their GP or to their chiropractor. But if it is an emergency, life-threatening situation, number one, I'll always say that you should go to the emergency room. Now, 98% of people don't have that situation happen. So for instance, with this person that may be asking me, say, "Beau, I've been having neck pain for a long period of time. I wake up with it, it doesn't go away. I may get some occasional numbness and tingling down my arm." Who's the right person to go to? Now, here's how we address that. If you should choose to go to your medical doctor, they are trained to do one of two things. Number one, to give you some sort of intervention to help you get out of pain. That's why when you go to a medical doctor, 95+% of them are going to give you some sort of medication. It may come in the form of an injection or an oral, meaning like a capsule or a pill, or they may refer you to someone to help you administer that medication, like a spinal injection person. So their job, number one, is to get you out of pain, and then number two, to help you diagnose at a deeper level where there is what they call pathology or where there is an issue at. So most of the time when a person would go to a normal general practitioner medical doctor, the doctor will look at it and say, "Look, yes, you're in pain, you're getting some stuff down your arms. Here is a x-ray slip or an MRI slip and a cocktail of different medications to help decrease your pain, inflammation, and swelling." That's kind of where they stop at. And to be honest, they do a really good job at that. Why? Because number one, if they can get you out of pain, and then number two, if they can help you diagnose what's going on at a deeper level, then they can refer. Because that's what most medical doctors are today. They're what they call portal of entry doctors, meaning all of these different conditions come into one place, and then that one sole doctor helps to refer the patient where to go next. Now, as far as chiropractic, if a person, and we see this every day, like I said, they'll come from their medical doctor, or what they'll do is they'll say, "Hey, Beau, I was having this neck pain, I was having all this stuff. I tried medication, I tried stretching, I tried heat, I tried ice, and nothing seemed to take care of it. Nothing helped to alleviate what was going on up here." And then they come into my office. Now, I tell all of my patients, if this is musculoskeletal driven, meaning muscles, bones, joints, ligaments, those types of things that connect and speak with the nervous system, chiropractic can handle it. Now, there are some things that we cannot do, but there are a majority of it, things that we do really, really well. In addition, most chiropractors, at least in my practice here, if we see something that is not chiropractic related or needs more or higher intervention than chiropractic, we will gladly refer to whoever that doctor or that therapist may be. Now, lastly, I'll say this, is that most chiropractors work with medical doctors, massage therapists, physical therapists, orthopedic surgeons, even emergency room doctors as well. So if you are experiencing neck pain, chronic neck pain, acute pain, that is not life-threatening, then I would highly suggest that you go to a chiropractor first if you can withstand the pain. If the pain is so bad, if it's 11 out of 10, right? Like you can't stand it, you're crying, it hurts, it's so incredibly bad, then potentially going to your medical doctor is the right route. However, like I just discussed with you, most medical doctors are going to do two things. They're going to give you a pain medication and they're going to help give you a different approach. They're going to look at it with different imaging or do different testing. And they do a really great job at that, guys. But even they will tell you, hey, Beau, I don't necessarily know what to do with neck pain, with low back pain. So I send them to you guys. And that's fine. That's what we do. Great. Send them over, right? And then what we'll do is we'll bring the patient in, we'll do our full assessment, we'll give them the diagnosis, and then we sit down with all of our patients and give them a treatment plan and say, look, hey, here's what you guys are expecting of us, meaning here's where you're at today, here's what we're gonna do, and we may say, hey, we're gonna work with a physical therapist a couple times a week, or hey, we're gonna work with your medical doctor, or hey, look, this is one of those situations where we may need to include an orthopedic surgeon if it's that bad. And absolutely, we will take x-rays, MRIs, CTs if needed, if warranted. If not, then we won't. But most of the time we will if we think that we need to. And then we'll give you a plan of action and best outcomes from there. So guys, only you can really determine who is the right person to at least start with. But I think it's important that you guys understand, number one, what is the nature of the injury? Number two, if you can understand the nature of the injury, number two, it'll help you best figure out who is the right doctor for me to get into their office with. And then lastly, number three, chiropractors are more than trained to deal with almost any musculoskeletal issue that's out there. And we work really, really well with the rest of our medical community to help build you the best plan of action to get you feeling better faster, moving better faster, and ultimately living a healthier lifestyle. If you guys have questions about neck pain, low back pain, what have you, as far as which doctor's office do I need to go into, please ask me down below in the comments. As always, I jump in at least the first few because there tends to be tens, if not hundreds of comments on some of these videos here. And I'll do my best to help you guys out. All right, hope you guys have a good one. I'll talk to you later.